The surgery center here at Center for Sports Medicine is one of the most technologically advanced facilities in our area, not just for a surgery center, but for all facilities. One of the advantages of the technology we offer here is the use of robotic assisted total joint replacement, which allows for a bit more of a personalized approach.
Same-day joint surgery is a technique that has been worked on for a number of years to have patients be able to go home the same day to their own homes and beds, recover in a faster manner, and be able to have less pain.
It's a big transition from how we used to do total joint replacements, which would require multiple days in the hospital. We've also improved our anesthetic techniques and pain control techniques to allow for less pain postoperatively, less sedation, less grogginess, less nausea, that allow people to start mobilizing with better outcomes whenever these procedures are performed at a surgery center.
We have a long discussion with the patient about the possibility of doing a same-day joint replacement or same-day surgery, and we go through their medical history and discuss their current medical problems, and also discuss their social environment, which plays a role with them getting home safely and recovering safely.
We also offer robotic assisted total joint replacements. We have 2 platforms that are available here at this center. They're state-of-the-art. The most cutting-edge technology is available here, so we can provide the most advanced techniques available for our patients.
We have a team of very experienced physicians that are all board certified in their specialties. And then we have a great support staff, whether it's in the clinic or the surgery center, that really do a great job and are very experienced in orthopedic care.
The Center for Sports Medicine is undeniably a leader for orthopedic care in our community. With our excellent surgeons, technological advances, and excellent staff, we're able to deliver the best of care to our patients and community.